In this morning's Health Watch, the physical and emotional costs of unemployment. With a jobless rate now over 9%, 6 million Americans are classified as long-term unemployed. The average person who has lost a job does not find a new one for 33 weeks.
Psychologist and early show contributor Dr. Jennifer Hartstein tells us that the effects of having no job, and in many cases no income, are deeper and more destructive than just not being able to pay the bills.
Something big had been taken away from me.
Bill Siegel was living the American dream with his family when he unexpectedly lost his job in 2008.
Did not think that this was going to be a long, extended period of being without a job.
Unfortunately, weeks turned to months and months into years.
More and more over time, seeing that we would not be able to keep up with the ongoing bills of just living in the house.
He lost his home. Then he and his wife divorced.
I can't blame it all on the fact that I lost my job, but it was a very big last straw.
In the latest Pew Research Center survey, close to half of those unemployed 6 months or more say joblessness has strained family relations. Nearly 40% of the long-term unemployed report they have lost some self-respect while they have been out of work.
It got more difficult as time went on.
Dr. Robert Leahy, director of the American Institute for Cognitive Therapy, is seeing the incredible impact of long-term unemployment and how it affects every aspect of the individual's life.
People who are unemployed for a longer period of time do have a rougher time. They feel more hopeless, they feel more helpless, and realistically, they may have a harder time getting back into the workforce where they were before.
It has been 3 years since Bill Siegel lost his job. He's one of the 2 million Americans whose job search has outlasted their unemployment benefits. He currently lives alone in a small apartment, struggling to make ends meet.
I just want to be in a position where I'm not defining myself as someone who's looking for work and trying to pay the bills.
And Dr. Jennifer Hartstein is with us now, early show contributor and psychologist. So when we look at this, what we just heard from Bill, most people would expect for the long-term unemployed, it's going to be depressing, it's going to be difficult to deal with. What are some of the main risks associated with long-term unemployment?
Well, we did hear him say, you know, his relationships really were impacted, his marriage dissolved. We also know that friendships can really be impacted because we don't want to necessarily be with other people who are employed when we are feeling such shame and embarrassment. Depression rates have been found to have gone up at least 3% over the last 5 to 10 years, which is pretty significant. And also, there are a lot of physical risks. What they have found is stress, we know, increases cholesterol. So there's increased cholesterol in these people. Cardiovascular conditions are getting worse because the stress takes its toll on our heart and all of those factors. Substance abuse and use is showing an increase, and mortality rate is actually going up. A study in Finland found that there is a 2.5 increased mortality rate amongst those that are unemployed than those that are working.
How can you, I mean, what do you do to make better use of the time between losing your job and finding new work? So some of those things that you mentioned right there don't happen to you.
Well, it's really, really challenging. And the key there is you need to be proactive in that time period. It's very easy to get so stuck in your hopelessness that you quit and you give up. It's so important to really be proactive, try and make finding a job your job, but just as with your regular job, you don't want to be so all-consuming. Yeah. So even though you might not have money, you can still go to the park with your family. You can still find opportunities to do those fun things that are going to build in some meaning into your life and be proactive and network and all of those important things we talk about all the time.
Which is a great way to combat that depression and the negatives there is to really focus on the positives and get out. Stop and smell the roses, as trite as it may sound.
No, absolutely.
So
you need to find that opportunity to do those things.
Dr. Hartstein, thank you.
Jen, thanks.